Hello and welcome to Dr. Kovak's Q&A. Today the question is, what can you do for the eyes? And there's a variety of things that we do for the eyes. We've all been doing it for years. Botox is kind of the number one thing that people like to do for the eyes. Treat around and sometimes even a little bit underneath the eyes with a little bit of Botox. It can help reduce the wrinkles. It's a nice treatment. We can additionally add fillers to help the sulcus underneath the eyes or potentially even the wrinkles that are on the outside of the eyes. These all work well. They're a little bit more short term, but they do a decent job. Some of the wrinkles do decently well with just Botox by itself, but if the wrinkles are a little bit deeper, you have to add a little bit of filler. But what I'd like to introduce today is our new device called Agnes. Now the Agnes is a great machine. It uses radio frequency and needles. We always use needles in this office. It uses needles to actually reform the tissue, to remodel the collagen so that the wrinkles actually significantly fade away. We numb the area, so there's really very little discomfort. There's a little bit of swelling afterwards, depending on the person, but the goal is to make the wrinkles look better, and if there's a little bit of swelling for a couple days, everyone can be fine with that. You just plan that ahead of time. But Agnes is a wonderful treatment. We go either underneath the entire lower lid, or we can do the upper lid. I usually don't like to do both at the same time just because you get both areas that swell and it's a little bit harder for people to function. But underneath the eyes is wonderful. So what I like to do is show you some pictures of Sandy, who had her eyes treated just before all this coronavirus event back in the beginning of March. And we treated just her under eyelids. Now, remember the approach is to do 2 to 3 treatments once every 6 weeks. And she's only had one treatment. This is her 6th week going into it, and so she's due for her 2nd treatment. But I want you to look on the monitor, and I can kind of show you the area. The only bad thing about these monitors, they show you the after first and before second, so we have to go backwards. This is, over here we have an X, is the before treatment. If we look underneath the eyes, you can see the wrinkles that are very, predominant there underneath the eyes. And then we go to the after treatment. This is 6 weeks later, and you can see how smooth it is, even with just one treatment. We make a big difference between all these wrinkles that are kind of along here to where there's actually nothing along here. So the Agnes is a great treatment that's going to give us a much longer term result than just Botox by itself or doing fillers by itself. That doesn't mean that we don't do those, because some of those deeper wrinkles will need filler, and they always need Botox, and we have to stop the formation. But this is a great treatment to remodel the tissue and give us a longer lasting and a smooth appearance and tighter appearance to the skin. So come on in and ask us about the Agnes, and we'll be able to kind of show you some examples and tell you a little bit about it. Hope to see you soon.